Hello, I am Dr. Priya, the glaucoma specialist at Zamindar Microsurgical Eye Center, Kalyan Nagar, Bangalore. Today I will be speaking on glaucoma medications. Glaucoma, as you know, is an irreversible disease, and once the diagnosis is made, the management involves preventing the progression of the disease and to maintain the vision which is found at diagnosis. In the first line of treatment, usually the doctor will prescribe eye drops, which are used to reduce the intraocular pressure or the eye pressure. Once the diagnosis is made, glaucoma, you should remember, is a lifelong disease. That means that the patient needs to use some medication or undergo some treatment, and this needs to be lifelong. Once you have a prescription given by the doctor, you must make sure that you understand what the drops are, the frequency of the drops, and the timing when the drops are to be used. In case the patient is elderly, which is in most cases of patients with glaucoma, the caregiver needs to understand the treatment given. Once the drops are bought, you must make sure that the correct drops have been bought and the date of expiry is checked on the bottle. Before instilling the drops, you need to wash your hands with soap and water, and when you open the bottle, before opening the bottle, you need to write the date of opening of the bottle. This is because any drops used in the eye need to be used within a period of 30 days. After that, you need to discard that and buy new drops. When you need to use these eye drops, you need to use your left hand to pull down the lower eyelid, hold the eye drop bottle in your right hand, and tilt your head slightly backwards, looking up at the ceiling, and press the bottle to instill the drop. There may be cases where the drop falls out of your eye. Don't worry, you can put another drop, and after putting the drop, you need to gently press towards the corner of your eye to make sure that the eye drop remains in the eye for a longer period of time. You might feel a slight bitterness in your throat after instilling the drops. In case of very elderly patients who have either arthritis or they have some tremors in their hands, they would need a caretaker to help them to put the drops. In case you have stiffness of the neck, then it would be easier for you to lie down on a bed, look up at the ceiling and put the drop in. For patients who have arthritis or difficulty in holding the bottle, there are these cups available where the eye drop bottle can be inserted into this area, and this cup can be placed over the eye and it makes it easier to be instilled. After installation of the drops, you must close the eye drop bottle carefully and place it in a cool, dark place. There are some medications which your doctor would have informed you which need to be refrigerated. In case you are traveling, you must make sure that you take the drops along with you and make arrangements to carry the drops. Some patients, especially the elderly patients who form the major population of patients with glaucoma, find it very difficult to remember to instill the drops. In a majority of patients, there are no side effects with the glaucoma medications. But the commonest problem that patients complain of are a mild redness in the eyes and a burning sensation as soon as they instill the eye drops. This typically only lasts for a few minutes, but if it persists and you find it bothersome, you could contact your doctor to change the medications. You also need to inform your treating doctor if you have conditions like asthma or any heart disease, or if you are allergic to any particular medication. There are some oral tablets which we also use in glaucoma, where you need to inform your doctor if you have any kidney disease. In conclusion, I would like to say that it is very important that you continue the use of the glaucoma medication and go for regular follow-ups so that your treating doctor can make any changes in the medication if required and keep a note of the progression of the disease. I hope these tips will be useful for you. Thank you.